Good morning. Welcome to Don't Be Last to Recognize Last, Integrating Simulation for Emergency Preparedness by Sharon Knauss. The administration of local anesthetic agents is often seen in the peri-op setting to provide analgesia for a variety of procedures. Too much of an anesthetic agent or accidentally injecting this into the vascular system can be life-threatening for a patient. Early recognition and treatment of local anesthetic systemic toxicity, also known as LAST, is essential for optimal patient outcomes. Simulation learning offers healthcare professionals the training and opportunity to recognize early signs and symptoms of LAST, the treatment, identification of resources, and enhances communication skills. Sharon conducted a literature review on LAST in the perioperative setting, as well as educational offerings using high-fidelity simulation. She identified current policies, standards, guidelines, as well as other resources within the Cleveland Clinic. A team was gathered to create the LAST simulation scenario with two goals. One, to increase awareness of LAST. Two, to practice the LAST protocol as a team during an in situ sim. The team met bi-monthly to review the scenario and conducted a dry run to ensure it was realistic. The LAST pre-brief, simulation, and debrief were facilitated at an ambulatory surgery facility at 3 different times. So what was the impact of this simulation? After each simulation, feedback was obtained from the healthcare team. Some of the fantastic feedback we received included: the LAST experience helped me understand this situation better. The equipment and scenario were reflective of my practice, and I wasn't aware of the checklist to be followed during LAST. Each of these were crucial items that were taken into consideration and built into education along the way. Information was shared regarding local anesthetic agents, recognizing the early signs and symptoms of LAST, and knowing the location of the emergency medications and equipment needed for this particular emergency. Closed-looped communication was identified and discussed as well. Location and naming of the fat emulsion and the various pyxuses was standardized across the ambulatory surgery facilities for best practice and continuity of care. This was a vital component as our caregivers float amongst the ASCs frequently. A LAST policy was created to meet the needs of patients and healthcare professionals. Our next steps: we will continue to evaluate and conduct LAST simulations at various locations. The LAST scenario will be incorporated into different educational initiatives, peri-anesthesia class, OR-RN residency, as well as a small team has met to develop a LAST My Learning module to be shared with the enterprise. Further assessment of other emergency situations and how in situ sim can be helpful to prepare the healthcare teams will continue. Thank you for your time.